Well, that's the picture on vaccines. Now, a groundbreaking genetic study is being carried out to find out why some people who contracted COVID suffered no symptoms and others became extremely ill. It involves collecting blood from very poorly patients in intensive care units across the capital, including Croydon Hospital. Now, blood from those who contracted COVID but didn't need hospital care are needed, especially men from black and ethnic minority backgrounds, as Carl Mercer reports.
For most of the last year, this is what Croydon Hospital's intensive care unit has looked like. COVID taking over, as in hospitals across the capital.
I was one of the doctors looking after you when you were with us, and it's nice to see you here.
One of the patients here was 51-year-old Anis, who spent 2 months fighting for his life.
I got 4 girls, all are young. Elder one is only 18. She's going to the university, and the second one at the 6th form, year 12, and third one, year 8, and the youngest one, year 7. I'm so upset that time. I'm going to miss everyone, you know.
Anis, like dozens of other intensive care patients here, had a sample of his blood taken to be sent off and analysed by a group that's trying to find out why COVID seems to attack different people in different ways.
This is what we want to understand. Why some of us kind of catch COVID and walk around and carry on with our lives as nothing has happened. Or some mild illness. I was unwell with COVID. It was a mild illness. But then there are some others who catch COVID and they are so unwell, needing to be admitted to critical care, and unfortunately some pass away.
At the moment, we've found 7 regions of the genetic code which make a difference as to whether you have a severe outcome or not. We need to find more of those. 3 of them have paved the way for potential therapies, one of which has moved into trials.
Local community workers think getting a better understanding of why particular communities are hit hardest could help get vaccination rates up too.
The feeling of helplessness, I think, and not understanding why us. You know, what is it we're doing, or what is it that we can do to improve things?
When it comes to public health as well, this is a new sort of variant or new sort of virus that what is going on. So you're going to have fear, you're going to have anxiety, and then you're going to have people panicking.
I think it could be helpful in, you know, gaining facts so that people have, you know, clear, trusted facts to kind of rely on in terms of making a decision.
Researchers now want people who've had less severe COVID to give blood samples. Carl Mercer, BBC London.
Well, if you want to sign up to take part in the genomic COVID-19 study and find out what's involved, you can do so on their website. The details there on your screen now. London